On yet?
Yes.
All right. Okay. Welcome everyone. You know that the smoke free pilot has started as of this Monday, and we agreed to have an half-hour session that will be recorded for people who can make it. There is an agenda that has been circulated, and that's the housekeeping. If you can mute your videos. When you need to take a break, please do so. If there's any issues or access issues, please email Yo-Yo and we will be able to record this and hopefully in time post them onto the academic or Health Innovation Network website. I believe Kerry is on the call and this is our agenda. So we'll talk through login processes, any features on the app itself, how we support our customers, but also give a live demo. And we'll finish around promotional materials, which some of you are aware that we are producing some resources that we'll post to particular hospitals that we've been given addresses to for you to use to scan and refer people on. But I'll pass you over to Kerry now, who will walk you through the training session. Thank you.
Thanks, Joe. Hi, everybody. Nice to meet you. I'm Kerry Johns, Operations Manager for the Smoke Free app. A little bit of background on me. I did work as Stop Smoking Advisor for 20 years, so I've brought that experience to the app, hopefully, and the way that we support people. And I started working on the app nearly 6 years ago now, and joined actually as a freelance advisor, helping out on the app, and then became customer relationship manager, followed by operations manager fairly soon after. So yeah, the app was actually launched 13 years ago. Dr. David Crane, our founder and CEO, still really works closely with us. Bit of history, he had a tech background and decided he wanted to change her career, went off to UCL to do a psychology degree, met the likes of Robert West and Jamie Brown and Sharon Cox and all those sort of iconic tobacco reduction specialists, and he gave up smoking just as he'd gone to UCL, and he hadn't had time to go to Stop Smoking Service or anything like that. So he made himself some little missions that he did for over 90 days, over a 3-month period. And whilst at UCL, he decided he was going to put those into an app and launch it to do a little bit of a trial, part of his dissertation. And so he launched the app 23rd of February 2012 and needed 500 participants. And the week he downloaded it, he actually got 27,000 people who downloaded the app. So at that point, he realised that actually, you know, there's people out there who might want support from an app. So the app is now quite well known throughout the UK. We're used in a lot of NHS organisations and local authorities, so around about 50 at the moment, and quit rates are really good, on average around about 57%, so almost rivaling face-to-face services. So I'm going to do a demo of the app and show you what it looks like. I'm going to kind of change the agenda around a bit. I'm going to show you the demo of the app first and then show you the resources and what you're going to get afterwards to help you give out the app. I think the biggest thing to know is that it should be a really quick intervention. VBA at its best, literally you can get somebody to scan a QR code or follow a link on their phone. They can have the app downloaded literally within a minute. And it's quick as that, and within 2 minutes they can be speaking to an advisor. So I'll show you what it looks like, and I'll tell you a little bit more about the app as I actually go along. So I'm just going to share my screen, and the app is actually live on my phone. So I just need to minimize this. So at some point I'll need somebody to let me know that they can actually see the app on my screen. Can you see that?
Yep. Yeah, we can.
Brilliant.
I can.
Okay, so I'm going to show you what the download process is like, because I do have a resource, but I'll show you that afterwards. So the user will be scanning a QR code or following a link. Some people aren't too good at using QR codes, so they can put the URL into the internet on their phone, and it will take them to the app. It'll download it, and at that point they get asked all the sort of questions that we need to be asking to report back data-wise, so their gender, age, ethnicity, all those sort of questions. Once they've completed all of those, we do guide them through it. There's a nice download process, so we guide them through it. We explain why we're asking those questions as well. And as they do that, they then come to a point where they'll be asked whether they're smoking rolling cigarettes, rolling tobacco, or normal cigarettes, how soon after waking they smoke, how many they're smoking a day, and how much that pack might be costing them. So that all puts together to make what we call their dashboard. We are changing the name of this, actually. It is going to be called Home Screen eventually, but it's not changed yet. So at the moment it's their dashboard. It's a bit darker. It's normally brighter on my phone than this, but I was messing around with the camera settings earlier, so it's actually gone darker. It's paler green than that. But yeah, so they get asked all of that. They also get asked to set a quit date. So some people are quite hesitant around setting a quit date, so they might set it fairly quite far in advance, and that's absolutely fine, because our advisors will talk them through it at that point when they come through to speak to them. So once they've downloaded, they'll have a predicted quit date then, or they might have actually, what we get quite a lot is that people do just download at the App Store. We are downloadable in 200 countries, so there's a lot of people going cold turkey, and they'll literally look for an app the day they're deciding to quit and come across Smoke Free. So yes, they might have a quit date that they've already started, or it might be in advance. So once they've downloaded it, they honestly can't break it. And don't be fearful of getting people to have a go with it. If for any reason they struggle with the download, we've got an email address. They can email, we'll take over it from there. You don't need to worry about it. So anywhere where it says explore, we encourage people to explore. It breaks down those minutes, seconds, hours of a quit. I know from working as an advisor that those first few hours and days feel like an eternity, so it's quite nice to see it broken down for them as well. We tell them about their offer. So on this offer, it's going to be swap to stop, so it will just say free vape, and as soon as they press to get started, that will take them straight through to our advisors to go through and discuss strengths of vape liquid. Quite often we're reassuring people that it is better than smoking. So the advisors will go through all those sort of reassuring conversations with them and get that ordered for them. So we do the orders for them on their behalf, and that gets posted out by Vape Done Lady direct to their door. They normally get it within about 3 days. If they have any issues, they come back to us again, and we will sort it all out for them. So that's not a problem. It shows their health benefits. So the minute their quit date starts, within 20 minutes, the pulse rate goes back to normal, the oxygen levels, carbon dioxide within 24 hours. So they close the ring, and they get a badge each time they're closing the rings. And we come right down to the bottom one, which takes the longest, decreased risk of heart attack, is comparing that to somebody who's never smoked. We do actually have a Facebook group, and we've got somebody who's just posted they've had the app for the 13 years that it's actually been out, and they've almost closed this ring. So it's a really nice screenshot to show people. So they close rings, they get badges every time they do that. They've got what we call a motivation card as well. So when they sign up, they also get asked their reason for wanting to quit. If they're in hospital, it might be for health reasons, so that is an option on there, but they can edit it at any time as well. So all they need to do is go in there, they can change, just type in their actual reasons for quitting. Can just about make out a camera icon there. If they tap on there, they can change that image, and you'll also see it says add image. They can actually use a gallery image from their own phone. So we get a lot of baby scan photos in there, or people who are doing it for their young family, or going on holiday even. They might even put a screenshot of a holiday in there. So they can change it at any point and put different photos in there at any point they want to. Got the money saved, so this will count up in lifetime. So I think I've got a date in of, I'm 2 months smoke free, and I think I put about 15 cigarettes a day on there. So it shows a predicted annual saving. So it saves on those circular cards that we used to have, the wheels where we show people how much they're going to save each month and week. Again, explore button is there, and it will break that down for them into days, weeks and months as well. A lot of people don't actually think about how much they're spending on cigarettes. They kind of find it from somewhere without actually realising how much it does amount up to over a year. You'll notice on there we've got spend on NRT and e-cigarettes. A lot of people self-fund, especially once the sort of stop supply has ended, and so they can add that in there just so they're showing a real time sort of saving and take into account anything they're spending on their NRT and e-cigarettes. You'll notice on there it says spent on cigarettes. We do ask people, whether they smoked at certain times. So if for any reason they report in there that they've had a lapse and smoked a cigarette, then it will take that into account as well. Craving section. When people come through to see advisors, they will encourage them to log their cravings each time they're having one. That's mainly because of the fact that it's quite nice when they're getting through those weeks to see that their cravings are decreasing on a graph. So the advisor will kind of encourage them to record the craving, whether they smoked or not. We're always trying to get that information out of people. If you said yes to that, by the way, it would automatically try and put them through to advisors to get them back on track or to reset their quit date as well. So that's the option that comes up then. Where was it? Where was the craving? We don't track anybody. They do have to opt into that, so they don't automatically get tracked in any way, shape or form. And how they were feeling. We know most people are feeling stressed, and mine's normally working and alone, or they can complete as many options as they like. They might have been, with somebody else or just eaten as well. They can add comments in there and then they submit it. And you can see there, it actually gradually starts to build up their triggers, list of triggers, so that when they go through to the advisors again, they can speak to them about what their triggers are. Again, a lot of people don't realise what's actually triggering their desire to smoke. We've got a separate section for the triggers as well, so it'll show the graphs and everything on there. I won't go through that because we don't have that long. Latest achievements, that's all the badges. So the minute they set a quit date, they get a badge. It's the app's trying to motivate people and reward them every time they make even one decision about quitting. The quit date is the biggest one, obviously, is the day they're committing to not smoking again. We've got time smoke free badges there. So we've got cigarettes not smoked, the amount of cravings they've resisted, the health indicators, money saved, missions. The list to go is endless, really, of the badges that they get. They get around about 95 badges in that first 12 weeks that are all designed to just keep motivating them and rewarding them and keeping them engaged with the app. We've got the progress section. This is such a simple section, but it is actually my favourite. The amount of cigarettes not smoked. So obviously I'm showing on my dashboard just over 2 months smoke free, and that's already nearly 1,800 cigarettes. The amount of cravings resisted, the life regained in days, that's based on 20 minutes per cigarette not smoked. And then the time spent not smoking, so 6.2 days already, and that's based on 5 minutes per cigarette, so it shows how much time is actually spent smoking, wasted smoking really. We've got the Wall of Fame on here as well. They have to opt in to have their name put on the Wall of Fame. This is offered to them at a point where they fill out their 4-week outcome. So between day 25 and 42, exactly the same as in any stop smoking service, we adhere to Russell Standard. They get asked whether they've smoked even a puff of a cigarette. If they answer no, then they're a valid 4-week outcome. And they get asked if they want their name on the Wall of Fame. At that point, they get a certificate awarded to them. They can print it off if they like. They can share it in the community group or on Facebook. And lots of people do. And obviously then they get asked if they want their name on the Wall of Fame. Again, another opt-in. And you can see on here, I mean, Tanya, she's been quit 3 years, still coming back and actually engaging to get that certificate each year. You see all the different flags on there as well, because it is around the world. We do get somewhere where, honestly, the amount of the stars they've got on there is quite incredible. But yeah, you can see people come back and engage with the app. And that's the thing, once the license has actually ended for any of your patients, they still revert and have the free features of the app, and we leave them with the community group. So they still have all of this to actually keep them going and keep them hopefully on track for longer than just the 4 weeks or the 12 weeks. We've got a saving up section. They save up for anything they like. They can put in as many items there. They can be as cheap or as expensive as they like. And each time the close ring, they get notified that they've saved enough money. And then we've got the missions. So this is the thing that started the app. I'll show you what one looks like. Designed to be nice, quick, simple, and easy to do. We tell them why it's going to help from a psychological point of view, and then they can make some notes, and then once they've completed it, they get a little bit of a gift at the end. So they run for 90 days. and they get each of those daily, so they have to be continuing on through their quit to keep getting those to do. They don't get all 90 in one go. Probably from your perspective, the most important thing is our support section. So I mentioned the community room. This is literally a chat room with people all over the world talking about their quits and what they're trying. Nice motivational pictures go on there all the time. People are encouraging with each other. The advisors moderate this as well, so do go in there, make sure everyone's being nice to each other. And but we generally just let people have that chat and post exactly like they would on Facebook. So we've almost brought our Facebook community into the app this way. We've got Cora. She's not available on these licenses at the moment. We're gradually releasing her around the world. She's a new AI chatbot, which will help with emotions and things like that. I put her through her paces Christmas Day, pretending to be alone on Christmas Day, and she's really, really good. So she's gradually being released on the app around the world. And then once we're happy that everything's working properly, she'll get released onto our licenses as well. Then we've got stop smoking advisors. Now, we have a team of 45 to 50 stop smoking advisors working on the app. They have all worked at least a year in a local stop smoking service. They're not just NCSCT trained, they are actual advisors that have worked in stop smoking services. They have to, like I say, have done at least a year before we allow them to work on the app. Most of them still work in stop smoking services, so they're all well versed on everything they need to know about smoking cessation. We've got specialists in pregnancy, mental health, all working on the app as well. And they literally work through the night and through the day. So it's literally a 24/7 service, 365 days of the year. So we get an awful lot of orders placed by people at 2 a.m, and they do get a reply in under 3 minutes. It's usually under a minute, but it's literally a text-based chat, and they will get a reply very, very quickly. They get notified when the advisors replied as well. So if they come out of the app for any reason, that'll pop up on their phone for them as well. We've also got the Quick Coach. The Quick Coach is another chatbot, but it delivers the standard treatment plan over a 12-week period, and it will do twice daily check-ins with people. They can change the frequency of that if they want to. If they don't want the check-ins, they don't have to have them. They can't ask questions with this one, so it's slightly different to Cora. It guides them through, but they can get motivational support at any point and some little quotes if they like. And again, when this is finished on the licenses, they keep it. So if for any reason they change their quit date or anything like that, this will all restart for them, so they get to keep it for life, basically. I'll come out the sports section very quickly, goes into the next fix. We've only got 10 minutes. Got a diary. They can create a daily diary. They can add to it as often as they like. This is where they'd put in whether they've spent on e-cigarettes or NRT. Again, we're asking if they smoked or not to try and get that data. Got a complete craving section, so lots of self-help there where they can read through help and support for when they're having a craving, activities they can do. We link them to games, puzzles, all that sort of thing as well. So we get a lot of people who just literally come through and speak to the advisors though until the craving's actually gone. And then we've got a list of all the, if I come out of that, all the missions there. So you see lots and lots of missions to do as well, and they get pre-quit missions. So for the 7 days leading into their quit dates, they got missions there as well. We've got a support section, so if they need any customer support or anything like that, then they can tap on there. They send us through an email, they get a reply within an hour. But like I say, most people just go through it straight through to the advisors because they know they're going to get an instant reply from them anyway. So that's the app very quickly shown to you. I'll come out of that and just minimize it and show you the download process. Now this is going to look quite small for you, and this is an example of our Greater Manchester sign-up process for patients. So this is basically, they scan the QR code. This will go to show the offer on the first sign-up page. It then takes them to the App Store. The reason they have this page, first of all, is the fact that that's going to make sure that they're going specifically to this offer and trial and not have to ever put in any payment details. It's not ever going to ask or come up with a paywall or anything like that. So they need to see that first page to know that this offer's working. they download, they then get taken through the process of downloading the app. So this is all this is actually doing. It will show that they've looked like they come from an offer, and then they get asked to put in their telephone number. We get them to validate their telephone number so that people aren't putting in false telephone numbers so that we can't contact them. So if they don't get it validated, then we can't actually put it through. So they validate the telephone number, and it tells them about their NHS offer. This is an example of it's actually an example of the staff offer in Greater Manchester. So they fill out their details. This is where they fill out all their onboarding details, and then that takes them to the dashboard. So it is literally takes about 2 minutes from start to finish, and then they can be through to an advisor. The resource we're having made for you is going to look like this. We've already got a flyer, so that's already been made, and that's been sent through to Joe and all the ICBs to work out what they want printed. That's been made into business cards as well. And then the other flyer we're having done is there you go. This is quite a nice one. So this is basically for you to use as your own kind of information as to what happens. So if you're giving it out, you can keep this on hand. You can print it out yourself if you like, or just keep it as a digital copy. But we're having one made. This is the Clarion housing, social housing offer. We're having one made for yourselves, and that should be over with you for tomorrow. So it will tell you exactly what to do and how to guide people through. And you can show this to users if you like. We'll put the correct QR code on there for each of the offers. So we'll do it for each area, and it will show them exactly what screens they're going to expect to see come up as well, and so that we know that everything's going smoothly and the download's going smoothly, and then straight through to the end where they've got their dashboard and the support. So I'm hoping that's quite a nice easy guide that you as staff can actually use when you're giving it out to people as well. So I'm going to stop sharing there. I don't think I've missed anything, but Joan, Yara, do you think I've missed anything?
No, looks good, Carrie. Thank you.
No, thank you. Yeah, it's quite interesting to see the interactive version of the tool itself. I know Yo-Yo had said that to people, if you wish to pop in questions, please pop in, but also you're able to unmute and ask any questions if you wish as well. Seems to be okay so far. Maria and Nicola have mentioned there, but no questions yet for you, Kerry.
Usual.
While people are still thinking of any questions, as Kerry has mentioned, we have got a budget which we will be printing the resources. So each trust has got a link or has got a packet of resources. Mainly that has been requested with ICB leads was just a business card and an A5 flyer, which you can then get your patient to scan the QR code. We are meeting with our comms team this afternoon, and once we manage to print those out, we've been given the addresses to post and the contact people to post them to. So hopefully, I mean, touch wood, everything goes to plan. We hope by the end of the week, we can have an update whether things have been posted, or to the very least by early next week. But we know that this is important for us to get them out. I can see there's a question from, so I can only see initials here as MT. Sorry, who is that?
Yeah, hi, yes,
Maria.
Maria. Yeah. Maria from South Tees Hospitals. Just a query on how do we get the quit numbers then? Because you said they got the 28-day quit in there and how they're doing at that point. So how do we get that back to us, and how do you know it's come from our organisation?
So each organisation have got their own specific QR code.
Right, okay.
So we will be able to see behind the scenes exactly where that person's come from.
Yeah, brilliant.
And then you'll get that data back.
Yeah, the app looks really simple to use, to be honest. I think that's probably why there's not a lot of questions, because it just seems so straightforward. And maybe I'm just thinking now, what's the catch? It's a bit too easy.
No, there is no catch.
Yeah.
You know, the idea is it's supposed to be nice and quick and easy for you guys.
Yeah.
We don't want to increase people's work, and so that's what I mean. If anybody does struggle to get it downloaded, sometimes they might have the the Wi-Fi might not be brilliant in the hospital, and so
Yeah.
we need. That's what I was trying to say to you, that if you're going to help somebody download it and you see that it doesn't go to that initial screen and it goes straight to the App Store, there's an issue somewhere, and that will normally be if the Wi-Fi is bad. It's kind of skipping the link, and so it's just a case of your best thing is to turn around and say, okay, take away one of the business cards with you, download it outside the hospital when you're home or something like that. But again, on that business card, it will have our email, not your contact details, to say if they're having an issue, to contact us and we'll take it over from there. So the idea is not for you to worry about giving it out and then having to answer questions or help people, if they're struggling in any way. We'll do that.
And one of my issues has always been with the swap to stop scheme is actually once they've swapped to the vapes, they're doing well, how do they get off vapes? But for us, luckily, Middlesbrough area have picked this up, and they are actually, from the 1st of July, the community team are actually helping people to stop vaping as well. And I don't know whether that's happening elsewhere in the country, but for us, we'll be able to let our patients know that they can do that once they've had the 3 months on vapes and they're cutting down to quit, because I personally would never, ever advocate a vape for long-term use just for quitting, just to prevent them going back to smoking.
If it stops somebody from going back to smoking, then anybody would argue that it is better. However, the whole point on the app, they get 6 months access, so that gives them time to come back, speak to the advisors will start discussing, weaning down process ideas of how to stop using the vape so much, but always assessing the fact that it's not going to risk that person going back to smoking.
Yeah, I mean, obviously stick to your vape if you're going to smoke again, but yeah, no, that's great, thank you.
Okay.
Yeah, I can see Naz has got a hand up.
Hiya, thanks, Joe. Thank you, Kerry. That was brilliant. Really like the app, and I think it's going to be so wonderful for our patients who are, digitally a bit savvy and have access to Wi-Fi to use this as a support in their pocket. So thank you for that. It looks brilliant. Really excited about the opportunity and how it's going to go. Just a really simple question, really. Can you just remind me, because I can't remember, how many licenses does Rotherham have? So how many cards do we get, and then how many licenses? Because I'm just conscious there'll be some people that might drop off, so you'll give them a card, they actually don't download it, or they download it and don't use it. So how does that work?
You don't have a specific number. We're after a specific number of quits, but you've not got a specific number of licenses. So the whole point is we would rather you give it out to as many people as possible, so that we get the amount needed quits wise, and we'll worry about the amount of licenses. If we think we're getting to the point where we're close to the number of quits we need for Rotherham, then we'll give you some advance warning that maybe you only need to give it out for another week or two, and then we'll have the number that we need probably to get those quits out of them. So don't worry about that. You're better off giving it to more than less, because if you hold back, then, like you say, they might not download it. So we'd then end up with half the number that we potentially could have got if you just giving it to everybody. I think it's quite important to let them know, though, that it is only swap stop. They're not going to get NRT. If they don't get on with the vape, we can't offer an alternative of NRT. We would have to start pointing them in the direction of their local stop smoking service or something at that point.
Yeah, no, that's brilliant. Thank you, Kerry.
But I think, Naz, it's a good point which you have mentioned, and a good response from Kerry. But what we've done as well, for transparency, I'm waiting for my my PowerPoint to load up. I just was going to refer to the numbers there. There's a total number of quits that this pilot can achieve. So we want to achieve 482 quits. But Kerry's point is important. We need to over-recruit to make sure that we get to 482 quits. And each area has got an allocation of, if all goes well, how many quits you should be doing. So you are right. There's a target for you guys to quit, but that's not just the licenses. It's exactly like Kerry has explained, that we will get back to you. If you're close to your quits, then we can say that, well, you've achieved your target. But don't you worry about the recruitment. We can communicate through the ICB leads back to you.
Yeah, there's 1,500 vapes. So at the end of the day, we're happy to honour, if we end up with 550 quits, that's absolutely fine, because you're not going to get charged anymore. Because we'll have supported that many people to ensure we get the amount of quits that we've agreed to do.
Naz, just quickly, I know it's 1 o'clock. Which trust were you again? Rotherham.
I'm at Rotherham. Yeah,
Rotherham. Okay. So just for transparency, and I think Kerry has mentioned it in a nice way. We want 1,500 vapes. But for the whole of South Yorkshire, we're aiming for 95 people to stop smoking or to quit through the app. But what it means with the loss to follow up, we will get a lot of people who might not actually quit. So don't you worry about it. We will be speaking with ICB leads in terms of are they close to the number of quits which we after. Sorry, there's one more person there. Again, I can only see the initials there. Please go ahead.
I think that might be me. I've got my hand
Yes.
up. I think that app's brilliant. Yeah. Am I right in thinking that is just for patients only, or can I be offering this to my staff members as well?
Technically, I'll answer that, and Kerry can add on to that. Anyone who's smoking who gets referred from an acute setting qualifies. So this could be people who work in the trust, people out in the community, but it has to be people who are coming from, who've been referred through the trust. Does that answer you?
So I could, if I was having chats with staff members and stuff, I could get them to scan the code, download the app. Because we do a lot of teaching on the wards and things like that. And what teaching, what kind of looking at, are you aware that we have a staff offer for?
I'm honest with you, from a public health perspective, if that person is smoking and they would rather quit and that helps them to quit and they'll be referred in, I personally don't have a problem with it. But Kerry, what's your opinion on that?
I don't mind at all, because at the end of the day, the importance is just getting people to stop smoking. Actually, getting staff to stop smoking sets a good precedent for the patients, doesn't it? Especially
it is. The evidence shows that staff that smoke are less likely to approach patients that smoke. So one's going to benefit the other, I think. And obviously, our patients are referred to local authorities from us seeing them on the wards and things like that. So are we all right kind of giving them the app and referring them to local authorities as well, because we provide NRT in the hospital?
To refer them to the local authority?
Local authority. Community services.
Okay, so communities, we don't want to discourage people from stop smoking, and there's a route from the public health, which is local authority led, and I know Dave Jones is on the call, he might come in on that. So I personally don't have a problem if people go to either of the services, because ultimately we need them to stop smoking. But they qualify if you refer them through the QR code to go to our service. Ultimately,
can they run alongside both services? So could they be seen?
No, one or the other, because otherwise we end up double reporting.
Double counting.
So if you know they specifically want NRT, then you're probably better off sending them through to the local community service. But if they want swap to stop and 6 months support and just use the app where they've not got to make any appointments, which a lot of hospital staff do struggle with, then they can use the app. But it should be one or the other.
Okay, Kerry is going to look at your question. Maria, I think you dropped a question in the chat, but Dave, I can see you've got your hand up.
Hi. Hi, everybody. It's a good question, Nicola. I think there's a couple of bits of value in this. I think the first is understanding. So when we set this up, it was to be specifically offered to those people who had an intervention within the hospital, wanted to quit, and then didn't want to go to their stop smoking service, or then we thought maybe the team had contacted them at 28 days and they hadn't managed to quit, hadn't been to the service and wanted some more support. So I think we were looking at a specific group in the way that we're trying to prove the benefit of this intervention for that population group. If that group's, and there's no, so on public health, yes, you'd want everyone to have it. The wider that group then gets, the lower the accuracy of us being able to say that intervention works. Now, we know this intervention works for people, as Smoke Free App have said, 57%. So giving it to staff certainly is something that you could do. I'd encourage your commissioner in your area to have a chat about what they want to achieve with it, because the more people who aren't within that population group, the less able we are to say that this is an effective intervention within that population group. So say we've got 400 quits and 50 of them come from staff, we're dropping below the magic number of 400 to get a confidence interval. So I think it's an interesting question, and nobody's going to say don't help somebody to stop smoking. But I would encourage people to primarily think about this as an intervention to support those people who wouldn't. They're offered stop smoking support for the local authorities primary. We don't want to take that away. And then if they're not able to achieve that or don't want to do that, then we offer them this app. And I think offer it. So the same would be to what we wouldn't offer it to relatives. necessarily because they're not part of this cohort. So because the part of this, the Health Innovation Network, is to say we're looking at an innovative solution to a problem that we feel exists, and that is those people who receive treatment and then don't go on to have care. So if the further we move away being able to say that the intervention did that thing, the weaker the research write-up will be by Health Innovation Network. So I guess I'm saying in the occasional instance, it probably won't make a difference, but I wouldn't make it policy or make it widely known. If it turns out that, 3 months into this, we're just not giving away apps to patients and we need to use them all up, then maybe so there, yeah, but that's a learning in itself. I'm happy to take comments from other people on the call on that, though, but I think that would be my take.
I think looking at it, I think obviously we're going to have to assess what the patient actually wants in terms of, like you say, do they want an RT or is it just a vape they want? We do get a lot of patients that do refuse referral to local authorities, so therefore would this app be a better option for them? And then that we're not losing them through the loss to follow up. And yeah, I get you where you're coming from now.
Yeah, quickly, the other thing is if you contact them at 28 days and they still want to do something, but they've not managed to do it, I don't think there's any problem with giving them access to the app as well. Yeah. Now, the issue is there's a couple of things. One is we need to report this back through local authority service numbers because of swap to stop. Mm-hmm. So we can report it through local authority stop smoking numbers. We also would want to report it as a 28-day post-discharge quit if that's achieved through the hospital. There's no problem with dual reporting these quits because those two data groups will never be added to each other. So if you refer to a local authority and you get a 28-day discharge quit, the local authorities can still report a 4-week quit. That's not a problem. So I think I always encourage everybody to follow up whatever happens at 28 days and report that. What we'll have to do, though, is we'll have to report all of these as if they were 28, as if they were local authority quits, because we're using swap to stop. We should also be reporting them in the tobacco dependency treatment database if they're a true 28-day post-discharge quit. Now, if the person, sorry, this is a bit technical, but it's probably worth just resolving. If the person, you contact them then at 28 day post-discharge and they've not stopped, but they show the intention to do and don't want referral to a stop smoking service, you can then provide them with the app, but then they'll get reported as if they were a stop smoking quit. They won't get reported as a 28 post-discharge quit because they weren't part of that. So there needs to be a way of you locally disaggregating those people who were given one at discharge and didn't do a thing, and those people who were followed up at 28 days and had that. But I think that's the local thing for tobacco dependency treatment services. But local authority, everything will come back to the commissioner, who will divvy up the quits between the local authorities, and they'll go in the quarterly returns. Just because we need to proof a return on these quits, it's not ideal, but it got free vapes with the offer and saved a huge amount of money and added a load more people who wouldn't have got one if we hadn't been able to do so. And I think the last thing is this is a proof of concept. The idea of doing this and writing with Health Innovation Network is if it proves to be good, mm-hmm. We've got a really strong position to go back and say, do you know what, actually? Let's do this scale. This teachable moment by this offer, and that's massively valuable to us.
Yeah, thanks so much, Dave, for that clarity. Very two quick questions, Kerry. One from Maria to say that can we use this for pre-assessment clinics, and the other one is can I ask if the vapes which are being offered via the app, what is the name of the vape, but also is there a certain time frame of support and certain number of liquids? I know the cartridges come in a packet. So those two questions, please.
It's through Baked In Lady, so they get an Inokin Arcfire pod device. So it's a refillable pod device. So they literally just change the pods every couple of weeks and they refill them in between. They get a total number of 18 e-liquids and replacement pods sent direct from Baked In Lady. It's one per person, so if they do lose it, we have to give them the link to replace in the vape. What we have been doing with other areas is what happens is a lot of people might have that first order. They get 3 orders, so it gets sent out 4 weeks at a time. They only get to choose one flavour, one strength. What we've done with other areas, typically the London Tobacco Alliance and areas like that, is that you might get some people who only have that one order. They don't go on and place any subsequent orders because they maybe start self-funding and buying liquids from elsewhere. We can actually utilise the vouchers that other people haven't used as well. So there's no wastage as such. If somebody, you know, gets through those e-liquids, if you've got a heavy smoker and they get through them quicker than the 12 weeks, which most people do, it lasts about 8 weeks, to be honest. Then we can kind of utilise somebody's unused voucher to give them a little bit more as well. So we kind of self-manage it behind the scenes, but yeah, it's all delivered direct to the door, plain packaging. Nobody knows what's actually coming through. And then Maria's question: can we use it for pre-assessment clinics? I'm assuming so. Outpatients and everything, I would have thought.
Yeah, as long as it's in secondary care or acute settings. Yeah. Okay, like I've said, thank you so much. I think you.
Could I quickly come back to that? I mean, I guess my point for pre-assessment clinics is it kind of, again, dilutes the data that we're getting if we're using different patient groups. Again, no problem if people want to, but if suddenly, again, 50, 75, 100 of these are given out in pre-assessment clinics, rather than people who've had the tobacco dependency treatment intervention at the bedside, which is the one we're looking to test, then it probably gives us a weaker ability to understand our data. I don't think there's an issue with us also potentially looking at other elements of this study in the future, but I would encourage people to stay quite strictly within the boundaries of what we're trying to do this time, and then make a case to do that separately. Just so, I mean, 400 is your magic number for a confidence interval and 95% of believing tests, and we're getting close to that anyway. So it's just, you know, people will do what they do locally, but I think it would weaken if we did anything, if we did significantly different from what you set out to do.
Thank you so much. Kerry, a quick question there, or are you answering that? About from Brett, was asking about if the app is up and running.
Yeah, it's up and running in Hull.
Yeah.
Do you mean the whole residence or the whole actual hospital setting? I'm getting confused now.
Hi. So, it was just one of the colleagues asked the question. So they've downloaded the app during today's meeting and they've been playing around with it, and it just, I think it's coming up with an error message saying, sorry, you're not part of the I don't know, I think the message has gone off. Yeah, sorry, you're not part of the trial, or you're not part of the right area type of thing. It's like an error message coming up.
Okay, so what link is actually being used to the app, or has it gone to the app store? Rather than you downloading it and using any licenses in any area, we can give you a code to test the app yourselves, because what we don't want is people who work for the intervention actually downloading it and then becoming part of the trial data.
Yeah, no, I completely get that. That might be useful, just so we can have a little bit of a play around with it. Maybe if we could have a little internal code that we could use rather than using up the licenses. I'm not sure, Gareth, did you use the app or the shortcode, or did you go to the download store?
No, we had the code sent through. We had the code sent through for the whole area, for the whole hospital, but it just seems to download the app itself as if anybody had gone on it, and you can't get beyond that first page, or it's trying to make you pay. Okay, so it's definitely not downloaded correctly on your I think
phone.
It's just like if someone randomly just downloaded it and gets access, because obviously there's a paid version as well, isn't there? So it's not enabling the free features at all from the codes that we've been given, from the QI codes.
Okay, so if you, I've put my email in the chat. If you want to email me, send me screenshots of what's happening. They've all been tested, so they should be working. So both all the QR codes and the links have been tested, and they're all up and live. So if you email me with a couple of screenshots of what you've got, so that I can then go back and find out what's actually going wrong and what you actually input as well to try and download it.
Yeah. Okay. Cool. That's Bill.
Thank you.
Thank you. Thank you.
Okay.
Sorry, I got a little bit confused because we've got an offer with Hull residents as well. So people in the area just download and put in their postcode, they also get swap to stop.
Okay, so that's probably different from us. Okay, we've got a working group, guys, which will be in July, I think. Yo, correct me, 9th, maybe 9th? Is it 9th?
Yeah, 9th of July.
9th of July. So hopefully on the 9th of July, next week. Yep. We will get feedback from you guys, but what we're doing in the meantime, we'll get the resources printed, which you can have a QR code, and hopefully we'll post them. But we can't post to you all. We've been given contact addresses to post to and contact people. So we'll try to make that a priority, and hopefully within next week we can sit again with Kerry and correct any errors if there's any errors. But Kerry has posted the email there. Please feel free, but also Yara, myself, and Yo-Yo are more than happy to answer any queries, or actually articulate the same queries with Kerry to help.
And I'll send details through to Joe of how you can download the app and bypass the App Store, anything like that, and you'll get free access then to the app for 4 weeks to test it out a little bit. Another thing that's quite handy to do is if you print off locally a picture of the QR code that's in for your hospital, a lot of people stick them onto their ID badges, so they can just literally turn it over and get the patient to scan it there and then. So it's just handy to have in the interim until you actually get some resources, for sure.
Okay, for the demo of the app, what we'll do, I know it's been recorded. We hopefully will maybe turn it into a video or share the link, and people can rewatch this video, especially the stuff that Katie was demonstrating. Thank you all so much. But please feel free to reach out if you need any information before next week's steering group meeting. Thanks, Kerry. Thank you so much.
Thank you. Nice to meet you all. Take care.
Thank you very much. Bye-bye.